not only understanding how that works, you have to understand homeo. So read that book. That's a good book.
Yeah, I'm always reading books.
Yeah.
Never ends.
So that's the difference of going, you know, and since I lecture a lot, I gotta keep up. Now, keep in mind, when a book comes out, when an article comes out, it happened 2 years ago. It's not current. So a lot of stuff we're doing things, or somebody else is doing it, right, that we haven't done yet, it's gonna come out 2 years from now. So when you're reading, you're catching up from somebody's work that maybe started 5 years ago. They finally get all together, then they publish it. So. All right, let's have a great day. Yesterday, you know, it was just for you guys to see. I don't expect you guys to have a great time. It's gonna be stressful, but act like you're having a great time. For the benefit, especially if the patient is not sedated, right? Just keep smiling, right? Protect the airway. Can't stress that enough. If you're not comfortable with your team member assisting you, tie floss. It takes a minute. Don't lose anything in the airway. So that's a no-no. Time yourself. Give yourself time. Get the patient comfortable, but don't over anesthetize. Trust the system. Trust your judgment. Trust the instruments. If something's not working for you in 10, 15 seconds, this instrument is not, then get a different instrument out, right? So the idea is have the end game in mind, relax, right? If you tense up, it's about making the right judgment, critical thinking, cognitive thinking. Dr. Sal Abrashi got me on this article, talked about pilots versus surgeons. Pilots make a bad judgment, 70% fatality rate, and surgery is about 5%. So if you cannot go from critical to cognitive thinking, something bad will happen. What does that mean? That means if you have a guide, right? Let's say you're doing a guided case, fully guided, and you go through the guide, and on the guide, the drill has either there's a stopper drill, no bells, it just has lines. You stop at 13. You take the guide out, or you put the implant in, and you're going in. You take the guide off and you just put it. You're expecting the implant to stop at 13, but it just keeps going, but you don't stop. Now you look back, the implant's 5 millimeters below the bone level. Cognitively thinking, well, it drilled to 13, the implant should have stopped at 13, but it did. Well, you could have perforated the sinus, you could have perforated the lingual plate, it could have just been bone marrow with no stop. So just always think critical. Yes.
That's some questions. So this is like pretty new to me, but I'm trying to understand all the prosthetic workflow.
Mm-hmm.
So do you mind if I'm just asking you questions
Oh,
during
100%,
the
that's why you're here.
procedure today? Okay.
Absolutely.
I didn't know if you wanted me to save them towards
No,
towards
no,
the break or
no.
Okay.
No.
Yeah.
Yeah. When you are have multiple personalities, you can talk. So, Dr. Melba and I will start together,
Yes.
and then it's your deal. I'm there to support you, right? But if I see things are not efficient, I'll say something, right? But we're gonna talk.
Okay.
We're gonna patients know. So I'm excited. You're gonna start with Dr. Roy. So the first thing you do is before you get the patient down, get that crown off. Give yourself 5 minutes. Do not spend 20 minutes. If there's no screw access hole, right? Just cut it, just like imagine doing an endo to a tooth. Just cut a hole, right? Big hole on top of that.
Right.
Find the screw access hole, retrieve the whole thing out, right? the reason why I don't want to destroy all that, right? Because you may be able to use it as a stop or for a bite, whatever. Just don't destroy it if you don't have to, right? So you can always take video with it again, right?
Yeah.
Because you have a stop. Why not? Because and as soon as you take it out, have a healing cap of an RP ready. Just put it in there. If it sits, take an X-ray. Then we're golden. You know that's a Nobel. You know we're good to go. If not, then you say, what am I doing? How am I gonna take a tooth out? Either we're gonna put a driver in, reverse torque it. If it's Nobel. If it's not Nobel, we gotta put in a reverse torque driver. It goes in there and engages. Sometimes they break in there. Sometimes they come out. Then we got trephine. An hour later, you haven't started yet. So, this stuff will happen.
Right.
So my recommendation is if you're taking an implant out, you're doing it all on four, you better have taken that above-crown off a month prior, put it back in, so you know what system it is. So, all right.